Hi, I'm Dr. Alan Aker. Most of you know me through my work as an eye surgeon at the Aker Kasten Eye Center. Through you and others like you, I became aware of the ever-increasing needs of our senior population. After discussing these concerns for the past several years with my brother, Dr. John Aker, he and I have formed the Aker Kasten Home Health Care Agency, which operates under John's leadership from this facility. John has been involved in the care of the sick and elderly for more than 35 years. During his Army career, John was assigned to 3 major medical facilities as well as 1 combat support hospital. Because John oversees the day-to-day operation and direction of Aker Kasten Home Health, I'd like him to explain our truly unique approach to home health care.
Thanks, Alan. Well, as Alan said, we've both been involved in the care of others for most of our adult lives. But that all became far more personal about 8 years ago when our mother had a series of strokes. We were fortunate in that all of us kids and our spouses, Alan and his wife, Dr. Aker Kasten, our sister Irene and her husband Art, and Rose and I wanted to be involved in the care of Mom. Ultimately, Rose and I became Mom's primary caregivers, and although it was challenging at first, we soon found our lives greatly enriched by our time together with her. But we realized that not all families are able to do what we did. Many adults living here in South Florida are miles away from their children and extended family without much of a support system. If they become ill or suddenly face the need for help with the activities of daily living, they can often feel very alone and fearful. And of course, their children and family living in distant cities can become quite anxious with the thought of a loved one far away, alone and struggling. Alan and I recognize that each situation is unique, yet with one common goal: the desire of aging adults to remain in their own home as long as possible with a skilled and sincere person who is tender and trustworthy at their side when they need help with the activities and tasks which once were so very easy for them. At the heart of all we do is a basic commitment to preserve the dignity of our patient, to promote his or her quality of life, and to protect the serenity of both the patient and his or her family.
These people truly care, and they are compassion personified. I had to be hospitalized, and the CEO and his wife came to visit me to see if there was any way they could be of help. When I was released from the hospital, the director of nursing came by my home to express her concern. They responded to me as only a family would.
We are blessed to have very dedicated and diligent caregivers as part of the Aker Kasten Home Health Care family, well prepared to serve you and your family.
Although I am not one who is easily impressed, I found the Aker Kasten Home Health Care Agency to be just great. The administrator, director of nursing, and home health specialists go out of their way to demonstrate genuine concern. My wonderful caregiver even sent me a postcard while in Alaska with her family. I can recommend them enthusiastically.
John, there are so many home health care agencies in our area. What makes Aker Kasten stand out from the rest?
Well, Alan, I've actually taken a page from your handbook when it comes to building a reputation as the agency where kindness and excellence meet. Our commitment to care embraces the whole person with a view to truly improving the patient's quality of life. This commitment is evidenced in care skillfully delivered, but with the sensitivity of family. Just as you have fostered a sense of family in your practice, we focus on the importance of relationship and reliability. The foundation of our care is assisting in the home with competence and compassion. Because so many in our society live far away from family, we offer our patients and their families the assurance that the Aker Kasten family can truly be an extension of their own in caring for their loved ones. Our success in caring as family is based on the quality of caregivers we employ. For this reason, we follow the example Alan has set in his own practice. Most of his staff have been with him for years and years. Alan's philosophy has always been to recruit good people, kind people, and then refine and sharpen their skills. So at Aker Kasten Home Healthcare, we strive to do the very same. We carefully recruit staff who are not only highly qualified professionally, but who are also deeply convinced that their vocation provides them an opportunity to live out their faith by serving others. Our home health specialists are thoroughly screened. After a rigorous application process in which we examine a candidate's credentials and his or her commitment to serving, we do a background screening with the Florida Department of Law Enforcement. We verify and evaluate all references, and then our Director of Nursing tests each candidate's practical skills. When we present our agency to potential clients, our boast rests in our staff. I'd like to tell you how our skilled family of caregivers can assist you. In addition to our skilled and non-skilled care, we also provide the following unique services. A check-in service. For that loved one resistant or reluctant to begin home care, we offer the best of both worlds. We provide regular phone calls and one weekly personal visit, and then we call or email the family with an update on their loved one. This service helps us establish a new relationship with your loved one, ensures your peace of mind for his or her well-being, and hopefully enables us to build a bridge to that day when care becomes an inevitable necessity. And when it comes to insurance, we file all the necessary paperwork to process your claim. We have a senior advocate who is available to assist with bill paying and bookkeeping, who facilitates communication with the primary care physician, and most importantly, keeps you, the family, informed. We maintain a 24-hour on-call phone line so that our patients know that someone who cares is always available. So whatever the need, caring for a loved one with Alzheimer's disease and related dementia, severe or chronic arthritis, Parkinson's disease, congestive heart failure, recovering from hospitalization or surgery, or assistance with the activities of daily living, such as light housekeeping, bed linen changes, laundry, grocery shopping, meal preparation, medication reminders, daily walks, transportation to doctor's appointment and social calls, and so much more. Aker Kasten Home Healthcare is here for you. We are committed to exceeding your greatest expectations and the highest standards of the home health industry. Aker Kasten is able to respond to unforeseen needs right away, and Aker Kasten is licensed and audited by the state of Florida. We are fully insured and bonded.
The Aker Kasten Home Health Care Agency is a family-style agency which is like having a family member at your side. Your emotional and physical needs are always covered by compassionate caregivers and the administrative team. No other agency can compare. My needs are always met by respectable, dependable, trustworthy people.
You see, at Aker Kasten, family is not simply a word. It's a reality. For any home health need, remember, at Aker Kasten, your necessities are our specialties. So let the Aker Kasten Home Health Care family care for your family.